Your first week in clinical rotation can feel overwhelming, but it doesn't have to be. With these 5 tips I'll be sharing with you today, I believe that it will be much more easier for you and you would also make a great impression. Hello and welcome. My name is Jude. I am a fresh medical school graduate. After navigating my own clinical rotations, I have learned what works and what doesn't. The first tip I'll be sharing with you today is that you should be prepared before you step in, because this is a new territory you are entering and this is actually an unfamiliar one. So you should ask a lot of questions, come up with a game plan. And it is needful that I say congratulations, you've survived the first half of your training, which is the preclinical. Now you are coming into the clinical arm, and trust me, this phase of your training is more intense and obviously it's unfamiliar, so you have to actually know what you are stepping into. You don't have to come and get surprised. Rather, before you even resume, ask a lot of questions, be mentally prepared, be financially prepared, and even be psychologically prepared for what you're about to face. Because in a clinical you're going to be dealing with a lot of pathologies and how to correct those pathologies. And you're going to be learning, especially in this first phase, in 400 level, you're going to be learning pathology and pharmacology alongside your clinical postings. Trust me, it's something you've not done before. You need to have a game plan on how to merge these two aspects of your training and not default in one. By now, I expect that you should have settled your accommodation plan. If you want to stay in hostel, you should have booked a place in hostel. If you want to stay off campus, you should have booked a place off campus. I would advise you that if at all you want to go off campus for any reason, you should actually look for a location that is close to your teaching hospital. There will be days that you might have to go home late, days you might be on call, and you can't risk exposing yourself unnecessarily at night. So it's best either you stay in hostel, and if for any reason you can't stay in hostel, you should actually get a place that is very close to your teaching hospital. By now you should have gotten your textbooks. Before you even resume, get your textbooks, especially the introductory medicine textbook like Hutchinson, introductory surgery textbooks, alongside your pharmacology, your pathology textbooks. For your clinical rotation, you should get basic assessment equipment like thermometer, stethoscope, your measuring tape, patella hammer, and your pen touch. These are the basic equipment you'll be needing. The second tip is that you should have a mentor. I would greatly recommend that you should be close to your senior colleagues. In that way, you are going to get guidance and also avoid repeating their mistakes. Then secondly, you should have a mentor, someone specifically that's available to guide you and to hold you accountable, especially in your clinical posting. Your mistakes might not be very obvious until your final exams, so you might just continue in error. So if you have someone to guide you and someone to hold you accountable, you might not fall a victim to most of these avoidable mistakes. Another benefit of having a mentor is that you can easily get free materials from them, and also they can even offer you free tutoring when you have difficulty with any of the subjects. The next tip, which is the third tip, is that you should have a can-do mindset, and also you should be eager to learn, because most medical students are actually introverted, and this phase of your training will involve a lot of talking, a lot of interactions with patients and with your trainers, and most people that are not so used to talking might find it difficult at first. But my advice is that you shouldn't relent, you shouldn't go back to your share. Rather, be eager to learn, be eager to adapt, be eager to change and to relearn and unlearn. The only way you can do this is having a can-do mindset, believing that you can actually cope, believing that you can adapt, believing that you can effect the necessary change required in this new phase of your medical training. And don't always shy away from responsibilities. Always volunteer to clerk patients, always volunteer to perform clinical assessment or clinical examinations, because it's the only way you can learn. If you're always dodging responsibilities or shying away from getting hands-on experience, you might not really learn. But once you start trying, at first you might be laughed at first you might even get it wrong and people will laugh at you, but the more you do it, the more you get better. So have a can-do mindset and be eager to learn. Don't be scared of making mistakes, because you are just coming into this new phase. You don't know any of these things before. The only way you can know them is by trying and making mistakes and getting better. And of course, at first, these things might seem so out of this world. They might seem so hard, but with continuous and unrelenting efforts, you are going to get much more better. I promise you that. Tip number 4 is Be smart with technology. If up until now you've not been using your technology to enhance your learning, this is the best time to actually inculcate that into your learning. When I mean technology, using your smartphones, using the internet to enhance your learning, there are a lot of good videos online. I would greatly recommend Ninja Nerd, Osmosis, and a whole lot of other channels that are dedicated to making your medical journey smoother and simpler. And also you can register with these sites or even subscribe to their YouTube channel for free and learn a whole lot with animated videos, just trying to simplify medicine for you. And also, if you have not registered on Medscape, you can actually register on Medscape. Medscape is a standard website. All of their materials are USMLE standard and they are like up to date, so you can register there to always cross-check your facts and also to read up some topics. Even though you should use this with discretion, ChatGPT too is there. It's something that can actually simplify your work. I'm not saying you should use it indiscriminately, but there are ways you can also use it in a smart way and it will make life easier for you. Hope you've been enjoying this video so far. If yes, please give this video a thumbs up. If you would love me to make a video on textbooks you can use in this phase of your medical training, in this clinical phase, drop that in the comment section, and if I get enough comments, I'll consider making that video. Kind of actually reserve the best tip for the last. Tip number 5 is don't work alone on this side of your training. Get yourself a tribe. That was one mistake I actually made initially, because I thought I could just read on my own, and because you have a whole lot to read though, a whole lot, and there is no way you can read everything. In fact, even if you get to read everything, if you don't talk, you might easily forget. So getting yourself a discussion group, a reading group, can actually enhance your assimilation and how fast you grab things. And get yourself a tribe, people you read with, people you discuss with, people that hold you accountable, people, if you don't come to class for like 2 or 3 days in a row, people that can actually reach out to you and ask what is happening. So don't walk alone. This will actually make life easier. In fact, this is number 1 hack of clinical rotations. Get yourself a tribe. Actively get involved in group discussions, in group study, and if you can, also offer to mentor anyone that is below you, anyone that might need your assistance, because the more you talk, the more you know these things, the more they stick. Because you have a whole lot to read, though. There's no way you can read all of these things and retain. But the more you dispense, the more you assimilate and remember. If you found these tips helpful, please give this video a thumbs up and don't forget to subscribe for more med school videos like this. Do you have any question or concerns about clinical rotations? Kindly drop them in the comment section. I would love to help. Thanks for watching this far. Do have a great day.